The Injured Senior Podcast is here to help. Like it or not, the senior and elderly population is vulnerable to negligence committed by medical professionals, nursing homes, assisted living facilities, pharmaceutical and medical device companies, insurance companies, and everyday individuals and businesses. Your host, Steve Heisler, creator of the National Injured Senior Law Center, has been advocating for seniors' rights for over 30 years and is bringing you answers to your questions. This is the Injured Senior Podcast.
Good day to all in our injured senior, elderly, and aging population community. This is Steve Heisler, founder and CEO of the National Injured Senior Law Center, and you are listening to the Injured Senior Podcast. The Injured Senior Podcast, for those listening today for the first time, is a podcast dedicated to discussing medical and legal issues of vital importance to injured seniors and elders, as well as to their children, loved ones, and caregivers. We are sponsored by the National Injured Senior Law Center. If you, or a loved one, a senior, an elder, has been injured by the negligence of a medical professional, a nursing home, the pharmaceutical industry, or others, get in touch with the National Injured Senior Law Center at www.injuredseniorhotline.com or 877-228-4878. We can help. So we have done several episodes on the ravaging effects of Alzheimer's on our senior and elderly communities and their loved ones. We've also talked to Dr. Rein Tideiksaar on the show previously to talk about falls in our senior and elderly communities, especially long-term care facilities, and how to prevent them. Today, Dr. Rein, as he likes to be called, is back on the show to talk about Alzheimer's disease and its connection to falling. Now, Dr. Rein, ladies and gentlemen, is the president of FallPrevent, LLC, a consulting company that provides educational, legal, and marketing services related to fall prevention in the elderly. Dr. Rein is a gerontologist, a healthcare professional who specializes in working with elderly patients, and a geriatric physician's assistant. He's been active in fall prevention for over 30 years. Welcome back to the show, Dr. Rein. How are you doing today?
I'm doing good. Thanks for having me.
It's a pleasure having you, Doctor. You're in New Jersey, so how's the weather out there? It's been cold and snowy here in Baltimore.
Yeah, we've had a little bit of snow. I had earlier this week about 20 inches to dig out of.
That's a little bit. That's more than we have. All right, so how common are falls generally in the senior and elderly communities due to Alzheimer's?
Well, out in the community, about 1/3 of older people over the age of 65 fall per year. And of course, that number or percentage increases as one gets older. Now, when you get to talking about Alzheimer's disease, a form of dementia, the percentage of falls increases to about 50%. So therefore, those individuals who have Alzheimer's disease, about 50% will experience one or more falls per year.
And are there certain risk factors that are common amongst Alzheimer patients for falls?
Yeah, when you look at the general older population and in terms of fall risk, the biggest problems are cognitive problems, problems with walking, balance, those types of things, also side effects from multiple medications. But when we're talking about Alzheimer's disease, there are specific cognitive and systemic effects that place individuals at risk. So, for example, in terms of the cognitive, people will have a lack of understanding and awareness of their potential for falls. Judgmental errors, such as inability to recognize a difference between a safe and a hazardous environmental situation. Overestimation of one's ability for safe mobility. thinking, oh, I can do this, I can walk here without a cane or a walker, and they lose their balance and they fall. Failing to remember limitations in daily activities, such as forgetting that they can't walk by themselves and that they need a caregiver to help them. Insistence on performing activities such as attempting to get out of bed despite the presence of side rails, or going to the toilet even though they're unable to do so independently. I think those are some of the cognitive problems that are associated with it. Then you have, in terms of gait or the way you walk and balance, that are affected as well in terms of the disease. That
it
people.
Sounds like. Oh, sorry.
Go ahead.
Go ahead. Yeah, I was just going to say that it sounds like that as far as the cognitive factor, it really just comes down to confusion. Is it sounding like that most people living with Alzheimer's who fall, a lot of times when it's a cognitive issue, it's confusion. They're confused that I thought I could walk, but I can't walk, or I don't know that guardrail is there, or I'm not recognizing it. Is that accurate, or sort of accurate?
Right. So what it really is confusion, but also in terms of a lack of immediate or short-term memory, that they can't remember that they can't walk safely, or they can't remember that they need to use a cane or a walker, or they have to call for assistance to help them with something like that. They attempt to do it themselves, and in the process they lose their balance and they fall or they trip over something on the ground.
Right. Is it more common amongst people with early onset, or is it more common amongst people who are in the later stages of Alzheimer's?
I think it's more common with late stages of Alzheimer's, because what you have is a layering of age-related changes that occur and general risk factors that happen, and then you have the Alzheimer's on top of it, if that makes sense.
It does. It does.
Yeah.
Okay, I'm sorry, I interrupted you. You were going to go, I guess, into the systemic effects part of the common injury risk factors.
Right. So in terms of difficulty walking and balance, that's all there. But the other thing that really places individuals at risk for injury if they fall is some of the visual aspects of it. Is that in Alzheimer's disease, they have a restriction of the visual fields, loss of peripheral vision, seeing side to side. They have difficulty in terms of the visual spatial function. In terms of inability to match and integrate the position of oneself with their surrounding environment, decline in depth perception, loss of contrast sensitivity, agnosia, which is decreased ability to recognize similar objects and places. All these things as well compound the risk of falls and injury in Alzheimer's disease.
Yeah, I did not know that there were spatial issues, or the visual fields of people living with Alzheimer's were compromised, and you're saying that is definitely a big factor as well.
Oh yeah, no, it's very common. It's very common.
Got it. So, are there common risk factors for falls for people with Alzheimer's? As far as additional risk factors, as far regarding what you just were talking about? Well,
if I were to discuss, in terms of what kind of strategies that caregivers could use in terms of dealing with Alzheimer's disease and the risk factors, I think the three major risk factors are mobility, cognition, and behavior. So therefore, if mobility becomes poor, cognition, people become much more confused, behavioral problems in terms of wandering, agitation, these kinds of things. Those are the big risk factors for falls. And I think that once you notice difficulties with one's mobility or their thinking, cognition, and behavior, that's when it's time to get an evaluation by a physician. So, for instance, in terms of cognition, we often think, geez, you know, the memory, my father or my mother's memory is becoming worse and everything like that. It must be Alzheimer's disease. There's not much I can do about it. The reality is that we can do a lot of things to reverse what's going on. So when a patient comes to me with memory loss, what I do is I evaluate what's going on inside to look for reversible causes. For instance, in terms of medications, is there a side effect that's causing this cognitive problem? Are they depressed? Is there some kind of a metabolic problem with blood glucose and other aspects in terms of the sodium and calcium that might be leading to this cognitive problem? Their nutrition. Do they have an underlying infection? Do they have some kind of other trauma, for instance, head trauma from a previous fall that's leading to confusion? Do they have some kind of a problem with arrhythmia or low blood pressure? All these things can lead to confusion, and they're readily treatable, which could actually lessen the severity of the confusion.
Now, are they doing these type of investigations as far as what you just were speaking about, as far as all the different potential health issues or medication issues? In your opinion, are they doing this sufficiently, say, like in long-term care facilities? Because, and I would think that there are probably a good amount of people living with Alzheimer's that are in long-term care facilities. Is that correct?
Right. I think when you get to facilities in terms of nursing homes and assisted living facilities, yes, that they all have geriatricians or physicians with experience in working with elderly people who are in charge, and they would look for these things, hopefully. But out in the community, it might be another factor. And most individuals with early stage Alzheimer's and everything like that are living in the community. They only go into a nursing home is when they have really difficulty in terms of unable to walk, maintain their balance. They have problems with urinary incontinence, et cetera, et cetera. So most of the individuals with Alzheimer's do live out in the community. And so the question is, do regular doctors look at these things? Not always. The best thing that caregivers can do is hook up with doctors that are geriatricians, doctors who have had special training in taking care of older people.
Right. So, and the geriatricians, obviously, they know what to look for. So you just take, if a caregiver or a child of a senior living with Alzheimer's brings their parent or the person they're caring for to a geriatrician, that geriatrician, does he have to, or she have to be a specialist in Alzheimer's, or is it any geriatrician usually will know what? No,
any geriatrician, because their training, they cover all the basics of Alzheimer's disease. And it's just not individuals who have documented Alzheimer's disease, because what happens with aging is that ability to recall things and memory declines. So a lot of normal age people without Alzheimer's may think, Jesus, maybe do I have early Alzheimer's happening or something like that? They'll go in for an evaluation, and the doctor should, or the geriatrician will look for all these reversible causes first before saying, oh, you have a diagnosis of Alzheimer's disease.
Got it. Now, is there certain things that caregivers or family members can do for a senior living with Alzheimer's in the home environment to cut down the risk of falls, other than in addition to bringing that person to a geriatrician for an evaluation?
Right, because the geriatrician isn't going to go to the home. Generally, they don't. A few of them will do home visits and everything like that, but, home visits are time-consuming, and people don't get paid for that. So a lot of the burden of looking at the environment falls on caregivers to do. And I think the most important thing to remember is and what I always tell, my colleagues and everything is that if I've seen one person with Alzheimer's disease, I've seen one person with Alzheimer's disease. Each are individual and each are all different. And so how do you deal with environmental problems? And there are a host of environmental problems with floor surfaces, lighting, bathrooms, stairs, the kitchen, et cetera, et cetera. But how do you start? You can't change everything, and you don't want to change everything, because when you do, you change the familiar and you make people much more confused. So the best thing to do is treat people as individuals and ask them to or observe them walking around within the environment and see how the environment provides safety for them or hinders their safety. How do they go from room to room? Do they hold on to furnishings? If they do, that's okay, as long as the furnishings are stable and they don't slide away. If they're using a walker or a cane, are they using this safely? How about the floor surfaces? We talked about some of the changes with gait or ambulation. What happens generally with people with Alzheimer's, they take short steps. They don't lift their feet as high as we do. So therefore, any kind of thick carpeting or door sills can become tripping hazards. In the bathroom, how do they get in and out of the tub or the shower, on and off the toilet? All these things. So therefore, once you see that there are safety problems with an activity, then you apply some type of modifications.
Now, would somebody bring in a company such as yours, like FallPrevent, to do that type of evaluation? Or
I've done literally, hundreds and hundreds of them. Absolutely.
Okay. Now, for individuals who don't have access to you or to FallPrevent, which is in New Jersey, if someone's out in Oregon or something like that, could they find a geriatric care manager that might be able to do that, or what do you recommend?
Yeah, geriatric care managers should be able to do that. The other thing is that you do have geriatric occupational therapists and physical therapists as well who can do that.
Okay. What do you think in the home environment is probably, and I understand you said you met one person with Alzheimer's, you've met one person with Alzheimer's. So I know that every situation is unique, but is there maybe one common, or the one that you see the most as far as trip hazards for Alzheimer's in the home environment? Well, the tripping hazards it's a big problem, that's for sure. But I think the biggest problem that I encounter is in terms of trips to the bathroom. And one of the things that happens with aging is that the kidneys and the bladder don't work as efficiently, and people wind up going to the bathroom maybe 6, 7, 8 different times at night. And generally what happens is you're getting up at night in a dark bedroom and then walking to the bathroom, wherever the toilet is, and you're going down a dark hallway and everything like that. And we know that if there isn't sufficient light coming in, that one's balance gets impaired as well. And we know already with Alzheimer's that vision is impaired and balance is impaired. So that's where a lot of falls occur. And then once you get into the bathroom is, of course, getting on and off the toilet in terms of, for males, urinating. These are all very, very hazardous activities. So if this is a problem in terms of getting up at night and going to the bathroom and everything like that, what you want to do is try to mitigate the risk. And generally, a lot of this depends on what the cognitive ability of the person is. If they have some cognition in terms of understanding, what you might do is provide a bedside commode during the night so they don't have to travel all the way to the bathroom. If they have cognitive impairment that they don't understand their disabilities or their inability to do the task safely, then it's up to a caregiver who has to be alerted that they're getting up from bed and they need assistance going to the bathroom. Yeah, so it seems like it's a pretty involved issue, and a caregiver or a family member really, really has to take this very seriously because I think you talked about this in the last episode that I had you on, that when they fall, it's not pretty. I mean, we're talking hip fractures and femur fractures. Is that
right? Because everything in the bathroom is hard. It's hard porcelain and everything like that. And the other important point about particularly the bathroom and Alzheimer's disease is that the older person with Alzheimer's might not be able to learn a new task. So if you want to provide grab bars or other apparatus to the toilet to assist with the activity, the individual might not understand what the use of these things are. So whenever you're doing a modification like that, you also want to observe, does the person really now use this modification? Is it really going to be safe for them? Or is this going to be an additional hazard?
Thank you for that. That's good information, Dr. Rein. Do you have any additional strategies that you can share with our listeners to prevent falls for people living with Alzheimer's disease?
Well, another behavioral problem, the behavioral problems, I think the major ones that I've seen clinically are wandering, agitation, and a thing that's called sundowning. And sundowning is a term that refers to individuals who are cognitively okay during the day. You know, they're manageable, but during the late afternoon, they become much more confused. And that's why they call it sundowning. And from my experience, the reason for this is that people get tired. And when they get tired and fatigued, they become much more confused. So therefore, if sundowning is happening, what you want to do is to let people take naps during the day so they're not so tired later in the day. Wandering is another big problem. Wandering outside, wandering in the middle of the night, et cetera, is you always want to look at the root cause of any kind of behavioral problem. What's causing the wandering? Are they looking for food? Are they looking for activity? Are they looking for toilet? What's causing the wandering and everything like that? The same thing with agitation. So whenever there's a behavioral problem, you want to look at what is the underlying cause for all of this? Is there a medication that's doing this? Those kinds of things to look at.
Is there any type of medication? Is there any type of medication that might be a little more hazardous as far as any of the psychotropic medications in terms of antidepressants that are being given to individuals and also antipsychotic medications to control behavior. All of these are fraught with all sorts of side effects that can lead to confusion. But again, depending on how many different other diseases individuals have, they could be taking all sorts of different medications. So all medications, they need to be on a regular basis in terms of looking at side effects. And for instance, when I have my patients, basically, if they're on medications, if they're on medication X, Y, and Z, for each of those medications, I say for medication X, these are the main side effects you should look for. Same for medication Y or Z. These are the 2 or 3 things you want to look at. If these things are happening, give me a call. Got it. That's good information. Because you have to remember that caregivers haven't gone to medical school or nursing school and everything like that. So you have to simplify things for people, and they have to feel comfortable in terms of what they're doing. They can't be, reading or looking at the internet what all the side effects are all the time. Yeah, and that's part of having a good practitioner-patient-family relationship and everything like that. Yeah, I've got parents that are 88 and 85. My dad's 88, my mom's 85. Thankfully, they don't have any type of dementia or Alzheimer's. But there's a lot of responsibilities as far as, just if they become impaired or unable to function, there's a lot of things, a lot of responsibilities that go into taking care of them. And I would think that would just be really multiplied if they had Alzheimer's as well. So I think the information that you're giving is important because would you agree that caregivers, for the most part, could really, if they're not, they don't have sufficient assistance from a geriatric care manager or the like, that they could be overmatched?
Yeah, no, I think the relationship between caregivers and the doctors or practitioners that are involved is absolutely crucial. And if they don't have a good relationship, that becomes a risk factor in itself.
Well, that is just great information, Dr. Rein. I really appreciate you taking the time today to talk to us. How can our listeners connect with you if they wish to? Are you available, or do you have social media that they can get you on, or what's the best way to
The best way to connect with me is basically through my email, which is drrein@verizon.net. That's DRREIN @verizon.net.
Again, thanks, Dr. Rein. Any last parting remarks that you'd like to make about falls and Alzheimer's disease in general?
I think the most important thing is that if you are taking care of an individual with Alzheimer's disease, it's a difficult task, that's for sure. But if there's a silver lining, is that there are a lot of problems that occur, which we have covered in terms of mobility, the environment, and confusion and everything like that, that are actually reversible, so that we can manage individuals at home. And so the most important thing is to get competent practitioners involved. If you go to see a doctor and they say, oh, your mother has memory loss, well, they have Alzheimer's disease, there's not much we can do. No, go to somebody else, get a second and third opinion, because there are a lot of things that we can do in terms of making life better for the individual with Alzheimer's and also the caregiver.
I thank you, Dr. Rein. You have yourself a wonderful day, and we're going to have you back on real soon.
Okay, thank you.
You got it. Injured senior and aging population community, thanks for listening to today's episode. I want to again thank Dr. Rein for appearing on the show today. He gave us just some great information that I'm sure we can all use. If you love the Injured Senior Podcast, we'd love for you to subscribe, rate, and give us a review on any of your platforms that you listen to podcasts. If you want to share your story on an upcoming show, feel free to email me at steve@injuredseniorhotline.com. I answer all emails. You could also leave a message if you go to our website, www.injuredseniorpodcast.com. Well, it's been a great episode. I'm looking forward to talking with you again next week. Stay warm if you're living on the East Coast. Stay safe, and I will talk to you then. Goodbye, everybody.
Thanks for listening to the Injured Senior Podcast. If you enjoyed the podcast, please rate, subscribe, review, and share on Apple, Google, or wherever you get your podcasts. Connect with us at injuredseniorpodcast.com and sign up for our newsletter. To find out more or to get help at any time, visit injuredseniorpodcast.com or call 855-622-6530. That's 855-622-6530.